Before talking about CKD diet, I would like to make one point very clear that there is no standardized CKD diet which fits all, because based on the stage of the disease, the blood parameters of the patient, type and the level of complications they have, and certain other factors, the daily recommendation for diet differs in CKD patients. So one should always consult with a qualified and experienced dietitian who is skilled enough to plan a renal diet which is individualized to the patient's needs. Here in this video, I am just going to say a few important aspects of a CKD diet. Now, before making any dietary recommendation, one should always know the probable complications that a CKD patient may have, which include hypertension, fluid retention in the body, presence of protein in urine, increased level of potassium and phosphorus in blood, hyperlipidemia or increased cholesterol level, malnutrition, decreased level of calcium, anemia, increased uric acid level, etc. Several studies show that around 40 to 50% of CKD patients are malnourished. And the reason for this is lack of awareness and also not consulting with an expert for diet. Another reason may be poor appetite, but malnutrition leads to decreased immunity level, which may make the patient prone to several infections, which may worsen the condition of the disease. Therefore, one should always focus on eating healthy. And before making any dietary restrictions, one should always look into the nutritional status of the patient and appetite level. And if it is low, then minimum dietary restriction should be made. Now, for a CKD patient, the daily calorie requirement is almost similar to that of a healthy individual, which is around 30 to 35 kilocalories per kg body weight per day. From these calories, 50 to 60% of the calories should come from healthy carbohydrates like whole grains. And diabetic patients should avoid or restrict simple carbohydrates. Less than 30% of the total calories should be from healthy fats. As such, there is no fat restriction for CKD patients. So healthy fats will help in providing sufficient calories to the patient and also help in making the food palatable. Around 10% of the total calories should come from proteins. Now, for those who are at advanced stage of chronic kidney disease, protein restriction is recommended, but recommended protein intake still remains around 0.8 gram per kg body weight per day. Many people suddenly reduce protein intake, which may lead to malnutrition and related problems. So one should remember that protein is very much required even if you have CKD, and sufficient protein should be included in your diet. For those children with CKD, no protein restriction is recommended because this may hamper their growth. However, more protein should be avoided, and one should focus on looking into the healthier sources of proteins. Several studies show that plant proteins are healthier than animal proteins for CKD patients. Plant proteins like beans, lentils, tofu, etc. are healthier options, and animal proteins like fish, egg, lean meat can be consumed in controlled portions. But while eating proteins, one should focus into the potassium and phosphorus content of these foods, because all these foods like beans, lentils, tofu, nuts, meat, fish, egg, milk and milk products, they have a significant level of potassium and phosphorus in them. So you should always consult with your dietitian to know that what type of protein in what amount you should include in your diet. Another important thing is sodium or salt restriction, which is very much required in CKD patients, and recommended salt intake is around half to 3/4 teaspoon per day. Minimizing salt intake would help in reducing fluid retention and also help in reducing the proteinuria or presence of protein in urine. And for this, for seasoning, you can always go for pepper powder, dhania, jeera, etc. One should also avoid eating foods which are high in salt content like papar, pickle, chutneys, soup, sauces, and other processed foods high in sodium content. Many people choose low sodium salts like pink salts, etc. But for a CKD patient, you should always go with normal iodized salt because low sodium salts are again high in potassium content. Another important food group, which is fruits and vegetables. There is again a misconception regarding this food group, and many CKD patients stop eating fruits and vegetables altogether. Yes, certain fruits and vegetables do contain high levels of potassium and phosphorus, but this doesn't mean that you should avoid all fruits and vegetables. For those who have high blood levels of potassium and phosphorus, they should avoid certain fruits and vegetables like tomatoes, potatoes, raisins, spinach, beans, bananas, orange, pomegranate, lemon, etc. But for those who have normal level of potassium and phosphorus content and who have mild form of CKD, they can safely consume these foods in controlled portions. For CKD patients as well as for diabetics, few fruits which are safe are apple, guava, papaya, pear, pineapple are low in potassium and low in glycemic index. Now, while considering potassium and phosphorus consumption, one should always remember that the absorption rate of these minerals vary from food group to food group. For instance, the potassium absorption rate from fruits and vegetables is around 50 to 60%, while potassium from animal sources, its absorption rate is around 70 to 90%, and maximum absorption rate of potassium is found in processed foods, which is around 90%. Same is true in case of phosphorus. The phosphorus absorption rate from foods like dried beans, lentils, nuts, is around 70%, while 100% phosphorus is absorbed from processed foods. So one should focus on avoiding processed foods which are high in potassium and phosphorus content. For example, fruit juices, mostly packaged fruit juices, cold drinks, cream sauces, pizza, macaroni, cheese, chocolate, ice cream, peanut butter, etc., and should focus on eating fresh foods. And before avoiding any food, you should always consult with a qualified and experienced dietitian who can guide you properly regarding what type of foods in what amount you should consume to manage your CKD. Thank you.